On this tab you can add a message to print out on the prescription for this provider. You'd need to specify the dates that you want this message to show for. So for example, only the month of January, and then type your message into the top 2 lines. If you're using the appointment reminder slip, you can also put a message onto this here. And lastly, you can add a message onto the encounter slip. So you can add 1 or 2 lines here, and then you've also got the option to add the header of the encounter slip as well. The surgical prompts is historical and no longer really used. Coming down to the options, you have the option to print enrollment forms with encounter slips. So when this is ticked, it just means the enrollment form will automatically print as well as the encounter slip for patients that don't have an enrollment status in the F3 screen. Display ethnicity prompt message. This means when a patient doesn't have an ethnicity entered in their F3, then a message will come up indicating this. There is the ability to enable granular prescribing directions, so I'll just show you how this works. I'll just open patient medications, so control F10 and new patient medication. So with enable granular prescribing directions ticked, this is how the medication window looks. I put my dosage in, frequency and period, and it populates the information into here. Now I can change it to non-granular by clicking on this icon, and now I can free type in. So basically, if a doctor likes to have the directions populate, they will have enable granular prescribing directions ticked. So when they open the new medication window, it will default to granular prescribing directions. If they prefer to free type it in, then they won't have it ticked in their staff setup. I'll just exit out of this window now and back into the staff setup. Display stat warnings controls whether the information prompt is displayed when prescribing. Default generic substitution allowed. So if this is ticked, on every prescription it will default to having generic substitution allowed printed on all the scripts. So doctors can easily untick this option when they're prescribing, but having this tick in here just means that it will default to be ticked every time they're prescribing. Eligible for co-payment. Basically it means if this is ticked, if the patient is enrolled and funded at the practice, when the doctor prescribes it will print with a 4 on the prescription, indicating that the patient can have a subsidized script. Enable repeat script without old drug warnings. If this is ticked, it will bypass the warning message when prescribing an out-of-date medication, and we definitely do not recommend having this ticked. Display interaction warning message should definitely be ticked. So you can choose to have only drug-to-drug or display drug-to-allergy warnings. Now the safest is to have display all interaction warnings. We do allow doctors the ability to not see the warnings, but we would always recommend displaying interaction warning messages and also displaying all of them.